Hey everyone, my name is Dr. Michael Wald. Thank you again for joining me for this conversation entitled End to Fatty Liver. This is a big deal because more and more people in society are being diagnosed with fatty liver. And in my 33 years of clinical experience, they don't know what to do next. So we're going to talk about that. We're going to talk about the diagnosis of fatty liver, what it means. Is it actually benign, like many doctors say, meaning it's really not a problem with your health? Well, we're going to find that out. So I am again Dr. Michael Wald, the blood detective. I'm a doctor of chiropractic. I have a board certification in nutrition, and I'm a dietitian and sports nutritionist. I provide acupuncture and I'm a life coach. And my education also consists of earning an MD diploma, although I do not have an active license to practice medicine. So this information is for your education. It's not meant to substitute for sound medical or health advice. So let's begin by just some definitions here. What is fatty liver? So fatty liver disease occurs when excess fat accumulates in liver cells, impairing liver function. That's why this condition is diagnosed when your doctor does some lab on you and sees that the LFTs, the liver function tests, are elevated. Either one might be, two of them, three of them, some combination of those. So there is what is known as non-alcoholic fatty liver disease, which means it's not caused by alcohol intake. And then there's NASH, or non-alcoholic steatohepatitis, which is a more severe form of fatty liver, which involves inflammation and destruction of liver cells. So we're going to proceed by just talking about fatty liver because the treatments are somewhat the same. So how, first of all, is fatty liver diagnosed? How do you know that you have it? Well, there are various blood tests, and again, they start with the liver enzymes, which are ALT and AST and GGT, and they will be elevated. Like I mentioned, one of them might be, two of them, all three of them with fatty liver disease. And then there is fasting insulin and glucose, and then a several-month average of your glucose test called a hemoglobin A1C. And these are often elevated, meaning that many people, especially women with fatty liver disease, have blood sugar issues and insulin resistance, which also tends to eventually form hypertension along with high blood cholesterol and certainly triglycerides, and usually low HDL. So that's why a lipid panel is also run, which at minimal includes triglycerides, the LDLs, that's the bad cholesterol, the HDLs, the total cholesterol, and the triglycerides. And then there are certain scans, like the FibroScan, which assesses liver stiffness and thus fat content. That's a very interesting one. And then a liver ultrasound, very easy to perform. It detects fatty infiltration. You'll see these bright areas in the liver on the ultrasound, which also show an enlarged liver because there's fatty streaks being deposited in that liver. And that liver has a capsule around it that's very strong. So if you deposit things inside that liver, it's going to squeeze those liver cells, and some of them are going to pop open. And those liver enzymes get into the blood, and that's how your liver enzymes are elevated with fatty liver disease. So those with fatty liver disease do tend to be women, and they do tend to be overweight or obese. And so the medical treatment, and certainly my treatment, would consist of weight loss. 5 to 10% of body weight is a very effective therapy in some women for mitigating the fatty liver. But in some people, some women and men as well, it doesn't work. So more has to be done with their biochemistry. For example, if there is hyperglycemia or high blood sugar or high blood cholesterol, obviously that needs to be managed as well. But think about it this way. The body or liver produces too much fat. It stores some of that fat in the form of the fatty streaks in the liver, as we've been talking about. And then the body puts other fatty streaks on the inside of your arteries, and that can eventually become atherosclerotic and also block circulation. So you always need to take all of the health issues with the client when dealing with fatty liver, because fatty liver almost never, I would say actually never, occurs by itself. There are always these comorbid causes or results from it that we need to manage. But in general, I'm giving you some guidelines. Vitamin E is known to help fatty liver. It may reduce liver inflammation, and that can reduce the fatty streaks. And then what are known as GLP-1 agonist medications, which may help reduce fatty liver in some obese people. And then managing metabolic syndrome, which I said before is a combination of high blood sugar, high blood pressure, and high blood fats. The more naturally these things are dealt with in my 33 years of experience, the better off the patient is. So I have some clients that say, Dr. Wald, I'm on these medical treatments. Can I do more because it's not working? Or they'll say, I'd rather not use medicine or medical procedures, so can we do this naturally? The answer is yes. Very often you can. So other conditions associated with fatty liver include insulin resistance. So that's one I've been mentioning a number of times because it's very highly correlated with fatty liver, and thus type 2 diabetes, which is non-insulin dependent diabetes. And then the high triglycerides. Triglycerides are the only fat among the cholesterol, LDL, HDL, that increase with blood sugar problems. So often you'll have a person with fatty liver, a big belly, or certainly at least overweight, and they'll have high triglycerides. And then, as I mentioned, they'll be obese, and they'll certainly at least have a lot of fat in the midsection. And then they may just have cardiovascular disease already, a history of stroke or heart attack. And if they don't, they are at increased risk of heart attack and stroke with fatty liver conditions. So we know that fatty liver is not a benign thing. I think doctors say that still because, and I went to medical school too, they just teach us to say that because when you're putting fat in the liver, that in and of itself is not a huge thing. But they fail to emphasize to the students, because these doctors are not getting it 10, 20, 30 years after graduation, that that fatty liver is just symptomatic of fatty problems, inflammation problems, probably blood sugar problems, blood pressure problems, blood fat issues. And we also have a high association in fatty liver with PCOS, or polycystic ovarian syndrome. So in that condition, we'll see fatty liver, then we'll see high blood levels of hormones like DHEA and or testosterone. We'll see insulin resistance and high blood sugar. And then eventually, as that continues, high blood pressure and then high blood triglycerides, or in some order like that. There's no particular order. And there are yet other conditions associated with these so-called benign fatty streaks. Sleep apnea. Intermittent oxygen deprivation contributes to insulin resistance and inflammation, which can cause fatty liver. Who would have thought that sleep apnea through inflammatory pathways can cause fatty liver accumulation? And then hypothyroidism, slower metabolism, and impaired lipid clearance, fat clearance from the body, can promote fatty accumulation in the liver. Your body's desperate to put the fat somewhere. Again, it sticks some of it in the liver, some on the inside of arteries. That's not good. Even gout, which is a condition, a type of arthritis characterized by high levels of uric acid or hyperuricemia. High uric acid levels are associated with metabolic syndrome, which is high blood pressure, high blood sugar, and high blood fats, as well as the associated liver fat buildup. And then even chronic kidney disease. It's linked to impaired kidney function, especially with diabetes. And gallstones, common in those with obesity and liver dysfunction due to disruption of bile metabolism. So as the bile metabolism is abnormal, the liver tends to accumulate fatty liver. Even inflammatory bowel disease. These are highly inflammatory conditions which stimulate fatty accumulation in the liver. So what are some additional dietary things for you to think about? So when I figure out what I call a blood detective diet, I'm basing that on a careful conversation with people, questionnaires, a survey of what foods they like and dislike, and then based on that conversation, I'm going to recommend lab tests, and based on those results, I know what foods and nutritional supplements a person needs for their particular manifestation of fatty liver. What works on one woman or one man may not work on you, and vice versa. So a Mediterranean type of a diet, again, the blood detective diet would be based on a Mediterranean diet / plant-based. And if you have a gluten problem, we have to consider that. And if you have blood sugar problems, we have to consider that in the diet. And if you have blood pressure or heart disease issues or cancer issues or something unique in your genetics, whatever is going on with you must be considered in figuring out a food plan that manages all these issues. But Mediterranean is not a bad place to start. Low sugar and low refined carbohydrate intake obviously is important because that's going to help minimize fat storage in the liver. And then reducing the intake of saturated fats in meat, butter, and fried foods will help lower the total load of fats that would otherwise be stored in the liver in the form of these fatty streaks. Coffee may reduce liver fibrosis as long as you have some coffee without sugar and without milk. But even though there has been studies on these, I've never seen that actually work in 33 years. It's usually a combination of things. And then there's avoiding alcohol. That is a big one. If the person I'm with does not want to reduce their alcohol or eliminate it, they will have no results in trying to mitigate their fatty liver, in my experience. Then exercise regularly, 150 to 300 minutes per week of moderate activity. And also that should include some strength training, which helps reduce visceral fat and helps improve insulin function, helping to mitigate that insulin resistance that causes, in part, fatty streaks to form in the liver. And then you want to improve sleep and reduce stress, because we just reviewed a few slides back how sleep and stress, especially sleep, will promote inflammation, and inflammation is a sort of chemical language for fatty streaks to form. So here's some nutritional supplements to think about. And as I mentioned before, some people may respond to some of these and others may not. There may be a unique combination that you need based on your testing. So we have to figure all that out. But choline is particularly important because it's a nutritional compound that mobilizes fat from the liver, and by doing that helps support bile production. And then there's methionine. Methionine is a methyl donor that helps detoxify fat and prevent its accumulation in the liver. I've given you some ranges of doses here, but based upon your lean body mass, that's really how you should figure out your dosages. Otherwise, you're just guessing on dosages. And these dose ranges that are given on bottles that you read, nutrient bottles, they're based on some averages that have nothing to do with you. So these doses may be too high, they may be too low. The combination of these nutrients may not be correct for you, they might be perfect for you. And then there is alpha lipoic acid, which is a powerful antioxidant in the B vitamin family that is very well studied to improve insulin resistance, and it's particularly helpful too for problems in the nervous system. And then milk thistle or silymarin helps to regenerate liver cells and reduce oxidative stress and inflammation. Very important. As is N-acetylcysteine, NAC, which increases glutathione and also is a very potent liver detoxifier and antioxidant in the liver itself. Just a few more nutrients to think about. Vitamin E, which I mentioned earlier on, reduces liver inflammation and fibrosis. And then there's berberine, which lowers blood sugar, improves insulin resistance, and reduces fatty accumulation in the liver. And then taurine, an amino acid, it aids bile and reduces oxidative liver damage. Now, some of these things sound similar in terms of what they do, but there's many types of inflammation, and there's many ways of getting to lowering that inflammation and reducing the fat. So generally speaking, a synergistic combination of supplements is ideal. And last but not least is L-carnitine. So L-carnitine reduces fatty oxidation and reduces the fatty streak content in the liver. So fundamentally, I start with a detailed medical and health history, looking at a food plan of what you've been eating and drinking for either 7 to 14 days. Based on that information and careful medical exam, I then will recommend various tests that will help me figure things out better than I can guess them. Although sometimes I'm able to guess things and we start in a more generalized way. And then I'll be comparing your blood work to healthy people and average people. So the regular doctors use clinical ranges, which are based on average people, and I use those as well. And then there are clinical ranges on a blood test, healthy ranges on a blood test, which are differently placed based on healthy people. So we want to try to get you in that healthy range as much as possible, not merely just in the normal range. And then, of course, nutritional supplements will be recommended depending on your lean body mass and other factors. So thanks everyone for joining me for this presentation on ending fatty liver. Some of the things I've mentioned in here actually have worked and can work for different people. It just depends on what your needs are. Let me know your thoughts on this talk and let me know what else you'd like to hear. Thanks again, and I'll see you soon.